Hi class, this week we're covering Chapter 7, Quasi-Experimental Designs. So with quasi-experimental designs, it's a little bit different than the experimental designs. There's one main difference, which is random assignment. So with experimental designs, the researcher manipulates the independent variable using random assignment. However, with quasi-experimental design, the researcher manipulates the independent variable but without random assignment of participants to the experimental and control group, or there is no control group with the quasi-experimental design. So such designs cannot be used to establish causality because there's no random assignment. So instead of using a control group when you have random assignment, what we use for quasi-experimental is a comparison group. So the comparison group is like the control group. This is the group that is not receiving the intervention. Matching is done to select participants in such a way that people in the comparison group are similar to those in the experimental group in some way, maybe like on their demographic characteristics. So quasi-experimental designs are used when it is not feasible or even ethical to assign participants to an experimental or control group. For example, random assignment is unethical when one wants to study the effects of a new medication on attention deficit disorder. Sometimes it's unethical to perform random assignment. So because with random assignment, you're assigning them to a group or control group that is not going to get the treatment, which sometimes can be unethical to do, especially in our field. Quasi-experimental designs allows addressing questions where research can inform practice and practice can inform research. Evaluating interventions where the studies reach the same conclusions can be used to inform social work practice. Study results can lay the groundwork for an experimental study. So even though the quasi-experimental is not as strong as the experimental, it can lay the groundwork for you to later on do an experimental study. It can also be used for evaluating the effectiveness of social work interventions with individuals, families, groups, organizations, and communities. And it can also be used for evaluating the effects of policy. So this type of design is well suited for exploratory research by examining the relationship between the variables, establishing at least an association between the intervention and the outcome. So the purpose of this research is to examine the relationship between the variables, at least to be able to determine if there's even a relationship or an association between the independent and dependent variable. The results of the quasi-experimental research studies can be used to provide insight about the effectiveness of the intervention. The research questions examine the association between the independent and dependent variable. For example, a question would be, is there an association between receiving job training and obtaining a job? That's looking at the association between training and actually getting the job. So there's two types of sampling strategy. Purposeful sampling, which is when you select people from the target population because of their fit with the purpose of the study and inclusion criteria. Convenient sampling is when you select people from the target population because they're accessible to the researcher. Usually participants come from naturally occurring groups such as a classroom, group home, or community. Data from quasi-experimental designs are analyzed using statistical methods. So just like with the experimental designs, there were several designs that fell under that. There's also several types of quasi-experimental designs. The first one is a non-equivalent control group design. In a non-equivalent control group design, individuals are not randomly assigned to either the experimental or comparison group. Pre-test and post-test scores are compared. So any differences between the groups can be attributed to the intervention. There should be no change in the post-test scores for the comparison group because they're not getting the intervention. So the standard notation for this design, if you can see, there's two groups. The first group has the pre-test, and then they have the intervention, and then they do the post-test. The second group does the pre-test, they have no intervention, and then they do the post-test. So when you compare the results of those two groups, the comparison group shouldn't show any change in their post-test because they didn't get the intervention. And usually what we're looking for here is whether the intervention made a difference or not. Just like with any designs, there's also threats to internal validity. So the first threat here is selection bias. Changes in the outcomes may be due to the group not being equivalent at the beginning because randomization was not used. So since they were not randomly assigned, the groups may not be similar. There may be interaction of selection and maturation. So the groups may differ because of developmental changes in individuals within the groups. So statistical regression to the mean can happen if we select people to be in an intervention or comparison group because of their extreme low or extreme high scores. Contamination effect is also an internal validity threat. This occurs when participants in the intervention group have an influence on participants in the control group. Resentful demoralization occurs when participants in the comparison group become aware of the intervention, and then they may feel that they are being denied benefits. Okay, so there's also threats to external validity. The first one is the interaction of testing and X. So X is the intervention, testing is your pre and post test. So due to pre-testing, participants may become sensitized to the treatment, so the results may not be generalizable. Interaction of selection and the independent variable. So this is when a characteristic of the participant, such as maybe motivation to change, may cause them to respond differently to the intervention, so then the results may not be generalizable. Multiple treatment inference is when participants were exposed to interventions prior to receiving the current intervention. So if participants were exposed to interventions prior to receiving the current intervention, then that may also affect the results. Some inclusion criteria mandate that participants cannot be currently involved in any other diversion program or treatment. Whenever there's multiple treatment going on, it's hard to tell which treatment is actually working. So data can be analyzed using the 2x2 ANOVA repeated measures, testing the pre-post test difference as within group factor and the group difference as between group factor and the interaction effect of both factors. So there's also the analysis of covariance, which is basically when you have multiple dependent variables, and then the analysis of covariance, which is also appropriate for this type of research design, especially if data is collected on confounding variables that the researcher did not use to match the samples. So the book gives an example of how this design was used to examine the effects of integrating evidence-based practice process into the MSW research curriculum. So the student participants with the new curriculum were in the intervention group, while students with the traditional curriculum were in the comparison group. They used a pair t-test to assess the changes on the 5 outcomes, which was familiarity, attitudes, feasibility to engage, intention to engage, and their current engagement in the EBP process. An independent t-test was also conducted to assess for differences among the intervention and the comparison groups. So this is just an example of how you could use this design. A time series design or interrupted time series design involves repeated observation or measurement of the dependent variable before and after the intervention is implemented. So the standard notation for this design, as you can see, there's multiple pre-tests, and then the intervention is given, and then there's multiple post-tests. This design looks at the association between variables. So the internal threats to validity for this design is history, reactivity, and instrumentation. History can be a threat if some event occurred at the same time that the client received the intervention, which resulted in the outcome. So if some other event occurred during the same time that the participants were receiving the intervention, it could have an effect on the results. With reactivity, changes in the target behavior could be due to the client recording their behavior. With instrumentation, a change in the measure used to assess the dependent variable can cause a change in scores on the dependent variable. So since you're doing pre-test, post-test, again, if there's any change in the measures used, so if there's a change from pre-test to post-test, then you would have that threat. So the trend line indicates the general pattern or direction of the time series design. So slopes of the trend line before and after intervention are compared. If the change is significant, then one can infer that the intervention did lead to the outcome. So in a natural experiment, who does or does not get the intervention is determined not by the researcher, but by nature or other factors outside of the researcher's control. There has to be clearly defined population which was exposed to some condition or experience, and a clearly defined population which was not, or the two groups were subject to varying levels of exposure. The process resembles randomization, although not done by the researcher. However, as there is no actual randomization, the process only allows researchers to infer, not establish causality. So this design is used to study the effects and evaluate policy. So natural experiments are used to study health and disease conditions, effects of policy, and disasters such as hurricanes in defined populations. So they're useful in evaluating policy effectiveness. So using a natural experiment, some researchers evaluated Germany's parental level benefits program. So with this research, they were looking at the policy that was implemented and whether that policy resulted in moms going back to work after 1 year of giving birth, moms going back to work after their benefits expired, or whether fathers took off from work to be more involved in childcare. So this design should only be attempted using samples large enough to detect the expected effects and when accurate data can be obtained on exposures, outcomes, and potential confounders. Threats to internal validity for this design are history and confoundings. So some event occurred at the same time as a natural event can also result in a different outcome. So for example, if we had a hurricane and a tornado at the same time, those are two different events happening at the same time that could have had an effect on the outcome. Confounding, the outcome is produced by something other than the intervention. So that's the confounding variable. So if something other than the intervention caused the change, then that's what we call confounding variable. There's no known threats to external validity for this design. However, establishing external validity is still of concern. The more representative the sample, the more confidence gained in generalizing your results. Data can be analyzed using a variety of inferential statistics, depending on the level of measurement, the number of independent and dependent variables, and the research question asked. So, ethical concerns associated with random sampling are not applicable in the cases where studies are conducted using pre-existing or self-selected groups who are already participating in a program. Obtaining informed consent to prevent oppression, abuse of power, marginalization, and alienation from occurring when conducting the quasi-experimental research. Individuals have a right to determine if they will or will not participate in a research study and when they will stop participating. In cases where the researcher plays a dual role of researcher and therapist, the researcher should make sure that the clients know that they have a right to refuse to participate and that the refusal would not result in a termination of services provided by the agency. Get someone else to obtain clients' consent to participate. Practices of obtaining informed consent may have to be modified depending on the participant's cultural background. Getting a participant's written consent may be inappropriate in a culture when there are low levels of education and literacy, and therefore the researcher may want to obtain oral consent from the participant or employ the use of a third party. All right, so that brings us to the end of chapter 7.